Hello, I am Kevi Ames, and this presentation will cover the modified clinical test of sensory interaction on balance. Please note the demonstration and images that follow show the modified CTSIB using the NeuroCom VSR Sport system with the 30-inch force plate. Other options for this assessment include the basic Balance Master 18-inch force plate and the Balance Master 60-inch force plate. The modified clinical test of sensory interaction on balance, or modified CAT-SIB, modified SIT-SIB, is a simplified derivative of the sensory organization test, SOT, component of computerized dynamic posturography. It provides objective evidence of a balance problem. This information, however, is not specific to the sensory systems involved. The modified CTSIB data provides the clinician with information required to support further assessments, as well as to be able to focus the rehabilitation plan based on the identified impairments. Normal balance includes the ability to remain stable in various situations, including firm and unstable surfaces, as well as with the eyes open and closed. During the modified CTSIB assessment, the foam surface creates a challenging, unstable surface on which limitations in muscular endurance, range of motion, or strength may cause instability. As such, instability on foam may or may not be associated with problems related to sensory system cues. Patients who are unable to successfully perform the modified CTSIB may be at increased risk for falls in their activities of daily living. For example, when performing tasks that require holding still, when negotiating environments where visual cues are diminished, or when negotiating environments where the surface is unstable or uneven. If instability is severe enough, the necessity to use hands for balance can limit functional tasks requiring bilateral upper extremity use, such as lifting and carrying objects, preparing a meal, putting toothpaste on a toothbrush, or washing one's hair in the shower. The modified CTSIB is a series of 4 test conditions designed to simulate conditions frequently encountered in daily life. The 4 test conditions are eyes open on a firm surface, eyes closed on a firm surface, eyes open on the foam surface, and eyes closed on a foam surface. In the first condition, eyes open on a firm surface, information is available and accurate for all 3 sensory systems, somatosensory, visual, and vestibular. This is the baseline condition against which all the other conditions are compared. This is the easiest condition, and therefore normal individuals tend to be very stable during condition 1. In the second condition, eyes closed on a firm surface, visual information is unavailable, while somatosensory and vestibular information is available and accurate. To remain stable, the individual has to rely predominantly on somatosensory inputs. High sway scores in this condition may imply difficulty receiving or utilizing somatosensory inputs for balance control. In normal individuals, we expect no significant difference in sway when the eyes are closed as compared to when the eyes are open on a firm surface. In the third condition, eyes open on a foam surface, we have made somatosensory information inaccurate as the compliant surface imposes an additional challenge to the musculoskeletal system. Visual and vestibular information is available and accurate. To remain stable, the individual has to rely predominantly on visual inputs and secondarily on vestibular inputs. Even normal individuals sway more on a foam surface than on a firm one, but typically do not lose balance. The instability on the foam pad may also contribute to postural instability when weakness or orthopedic impairments are present in the lower extremities. Stability on the foam can also become more challenging as the patient fatigues. Therefore, a clear correlation with sensory system involvement cannot be easily identified. In the fourth condition, eyes closed on a foam surface, visual information is unavailable. Somatosensory information is inaccurate as the compliant foam surface imposes an additional challenge to the musculoskeletal system. Only vestibular information is available and accurate. To remain stable, the individual has to rely predominantly on vestibular cues. Normal individuals may sway significantly more with eyes closed than with eyes open while on a foam surface, but typically they do not lose balance. The instability of the foam pad also contributes to postural instability when weakness or orthopedic impairments are present in the lower extremities. Stability on the foam can become more challenging as the patient fatigues. Therefore, a clear correlation with sensory system involvement cannot be easily identified. At the beginning of the modified CTSIB, or any assessment performed with the static force plate, the system may prompt you to calibrate the force plate, as the system will detect if the force plate is not level. The force plate does not typically require calibration unless it has been moved. This brief video demonstrates the simple and quick calibration procedure. The same calibration procedure is used for the other NeuroCom static force plate models. Occasionally, before you start testing or treating a patient on the system, you will get a message from the NeuroCom Balance Manager static system that says, before you begin, the force plate must be calibrated. This is to be sure that the force plate is level and the data collection is accurate. This step cannot be skipped. It's very easy to calibrate the system. I'm just going to follow the instructions on the screen. The first instruction says use the adjustment tool, which is this tool, to turn foot 1 all the way counterclockwise. I can tell foot 1 because it's in the top left-hand corner of my screen, which correlates with the front left corner of my force plate. So I'm going to drop the tool all the way in, and I'm going to turn it counterclockwise all the way to the left until it stops. Then the instructions tell me to step onto the force plate. I'm stepping all the way onto the force plate, and then the instructions tell me to step off. Once I have stepped off, I will get another instruction. While watching the screen, use the adjustment tool to gently and slowly turn foot 1 clockwise until all feet turn steady green. Do not push down while adjusting. So slowly, while watching the screen, I am turning the tool and I'm waiting to see all of the feet turn green. And I turned a little bit too far, so it's telling me now to turn a bit counterclockwise, and now all the feet are green. Please step onto the center of the force plate with both feet to verify the force plate is firmly set on the surface. Please step off. While watching the screen, use the adjustment tool to turn the foot counterclockwise until all feet turn steady green. All feet are green. Please step onto the force plate. Step off the force plate. And now the force plate is level and we are ready to begin our test. This section of the presentation guides you through the proper steps to complete the modified CTSIB assessment. This demonstration utilizes the VSR Sport 30-inch or 72-centimeter force plate. The same assessment can be performed on the basic Balance Master 18-inch or 46-centimeter force plate and on the Balance Master 60-inch or 152-centimeter force plate. We are now going to demonstrate the modified clinical test for sensory interaction on balance, or the modified CTSIB. I've got my patient loaded in the system. From the assessment menu, I click on Modified CTSIB, and when I click on Continue, I get specialized instructions. The first thing that I need to do is make sure that my patient is in the standardized foot placement. If you forget how to position your patient in the standardized foot placement, you can click on this green oval on the screen and watch a video. The instructions tell me that I'm going to align the patient's medial malleolus to the center horizontal line and the lateral calcaneus to the M line. The easiest way to approximate the standard foot placement is to ask your patient to stand with their arches of their feet covering the circles. Now, to make sure that her feet are accurately positioned, I'm going to check to be sure that her medial malleolus is over the horizontal line and her lateral calcaneus is by the M line. To be sure that my patient is in the standardized foot position, I'm going to make sure that her medial malleolus is over the wide horizontal line. And to do that, I'm going to just drop a straight edge and make sure she's lined up appropriately. On the other side as well. And then that her lateral calcaneus, or the outside of her heel, is lined up with the M line. So I need you to move your heel out just a little bit, a little more. There we go, perfect, on the M line. And this one as well, move your heel out a little more. Great. And once your heels are in the right place, feel free to splay your toes a little bit for comfort. That looks great. And now we are ready to begin the test. I'm going to click on the Continue button. This test is measuring how stable you are when we challenge you through different conditions. The first condition, you're just going to stand comfortably with your eyes open on a firm surface. This is our baseline condition. Please stand as quietly as you can. Look straight ahead. Keep your eyes open. I click the Start button to begin the test. There are 3 10-second trials for each condition. And the first trial is completed. I can go back and repeat a trial if I'd like, but I don't have any reason to do that here, so we'll go on to the second trial. Eyes open, stand as quietly as you can. And now we're going to start the second trial of the first condition. Keep your eyes open, look straight ahead, stand as still as you can. And we've got the timer moving across that lets us know where we are in the trial. Almost done. Great. And we'll do one more trial on condition 1. This is our baseline condition. All of her sensory inputs are accurate. She's got vision, she's got somatosensation, and she's got vestibular, all working for her accurately. And now we will do condition 2, which is eyes closed on the firm surface. When you're ready, close your eyes. Great. Stand as steady as you can. I'm going to make sure that my patient is safe. Keep my eye on her while she does the test. It's a 10-second trial. Great. Open your eyes, and we will do 2 more trials of the same condition. So when you're ready, close your eyes. And I'm starting. You're doing great. And open your eyes. We'll do 1 more of this trial, this condition. Ready? Mm-hmm. Okay, when you're ready, close your eyes. Great. And open your eyes. You did a great job. So the next 2 conditions, we are going to put a foam pad on the force plate. As you can see, we've put a foam pad with a non-slip surface onto the force plate. Sometimes during these 2 conditions, it's difficult to get exact foot placement because of the foam. You can use aids to help you do this. For example, some people will put a walker in front of the foam so that the patient can hang on to something while they are getting onto the foam and you are adjusting their feet. For our purposes today, I'm going to have our patient place the arches of your feet over the circles, and while you're doing that, you can hold on to my arm to help you get up safely. Good. Great. Once you're comfortable, I'm going to check your foot placement. You okay?
I'm good.
Great. And I'm going to look to see, do we have the medial malleolus over the horizontal line and the lateral calcaneus to the M line? And she looks good. These next two conditions are more challenging than the first two because she's standing on a compliant surface, which is going to make her somatosensory cues inaccurate. The first trial on the foam is condition 3, eyes open on a foam surface. When you're ready, I just want you to keep your eyes open and stand as steady as you can. You ready?
I'm ready.
Okay, and I'm hitting the start button and I'm making sure that she's safe. Great. Doing okay?
Yes.
Then we're just going to run through the next two trials quickly. As you can see, she's got quite a bit more sway in this condition than she did on the firm surface. This is normal. We would expect more sway as the conditions become less and less stable. Last trial of condition 3. If I was really concerned about her balance, I could leave the walker in front of her. She could grab it in an emergency if she were to lose her balance. I could also put a chair behind her so that if she needed to sit down, she could do that easily. This last condition is eyes closed on a foam surface. I'm anticipating that she is going to be much less stable in this condition. When you're ready, close your eyes. As you can see, she immediately becomes a little bit less stable. I'm standing very close to her. If I should have to touch her or intervene in any way, that would be marked as a fall. Great, open your eyes. I'm going to give her a break between trials so that she can open her eyes and recenter herself. You ready?
Ready.
Close your eyes. You're doing great. It's my job as the operator to make sure that she's safe at all times. Open your eyes. Last trial. Here we go. Close your eyes. If I was worried about her safety, I would have another person up here with me. I would be using a gait belt. I would have other safeties in place. Open your eyes. Great. You doing okay?
Yes.
Great. You did a really nice job. When we're finished with the test, I'm going to help her down off the foam. And then we are going to take a look at the results. Now that the test is complete, it's time to analyze the results. This is a sample report showing what the NeuroCom software will generate following the assessment. The modified CTSIB results show the center of gravity trace for each trial at the top of the report, along with the sway velocity and total duration of each trial. In this sample report, for trial 1, the patient had a very low sway score over the 10-second trial. By looking at the results of this report, you can see that the patient performed well for firm eyes open condition, as well as the firm eyes closed condition. But there was a lot more sway for the 2 foam conditions, including a fall in the second trial of the foam eyes closed condition. The center of gravity sway velocity is the ratio of the distance traveled by the center of gravity, expressed in degrees, to the time of the trial. The greater the patient's sway, which means greater instability, the higher the sway velocity score. Decreasing or lower sway velocity scores show improvement or increased stability. For example, if an individual leans forward 6 degrees and then backward 4 degrees, right 3 degrees, and left 2 degrees, this is a total distance of 15 degrees. If the trial lasted 10 seconds, the center of gravity sway velocity would be 15 divided by 10, or 1.5 degrees per second. The distance is expressed in degrees instead of inches or centimeters to allow for the comparison of scores for individuals of different heights. The amount of sway is expressed as velocity to permit comparison of scores between trials of different durations. A fall is recorded as the maximum sway velocity, or 12 degrees per second. The lower half of the report details the mean center of gravity sway velocity for each condition in a bar graph format. Green bars on the graph indicate normal responses. Red bars indicate abnormal responses. The bar labeled COMP on the far right of the graph indicates the average balance control over the 12 trials. The center of gravity alignment data reflects the patient's position relative to the midline at the start of each test. Interpretation of sway velocity addresses the following clinical questions. First, how much did the patient sway? How stable or unstable was the patient? Normal balance includes the ability to hold still in various situations depending on what the activity or circumstance demands. The center of gravity sway velocity scores indicate how well the patient accomplished this objective. Lower sway scores are better because they reflect little movement. Higher sway scores reflect more movement, so they are worse. How did the patient perform under stable versus unstable or foam surface conditions? Normal individuals have significantly more sway when standing on a foam surface versus a firm surface with their eyes open, and even more sway on foam when their eyes are closed. Patients presenting with abnormal amounts of sway or falls on these conditions may have difficulty using visual or vestibular cues for balance, or they may have lower extremity musculoskeletal problems, which make it difficult for them to stand on the foam or compensate for the unstable surface. Overall, what was the patient's balance control under each of the 4 conditions? What was their mean center of gravity sway velocity? In all conditions, low sway scores are better and high sway scores are worse. It's expected that as sensory information is removed or rendered inaccurate, sway will increase. Excessive sway and/or falls, however, are not observed in healthy individuals. What are the functional consequences of the modified clinical test of sensory interaction on balance results? In this example, the patient exhibits the most sway and even a fall when the surface is unstable, when they are on the foam, and when visual cues are absent or their eyes are closed. This patient may have difficulty maintaining balance during functional activities, such as walking to the bathroom at night on a thick carpet, or walking on uneven surfaces such as grass or a parking lot at night. Finally, this chart provides guidance on how to use impairment findings to drive medical management and rehabilitation planning based on the results of the modified CTSIB.